Hi, welcome back. I'm Dr. Patty.
I'm Dr. Angela.
Thanks for stopping by. We hope you are doing pretty well. Today, we're going to talk about hair thinning, hair loss, how to regrow your hair. Clearly, Dr. Angela does not have that problem.
It's not true. My hair is actually maybe a third thinner than it was in my 20s. I just have a lot of hair.
Interesting. Okay. Yeah. And mine's from a haircut. I just got my haircut actually just today. So this is not from hair loss.
You have lots of grateful hair. It's just straight, so it doesn't look as poofy as mine.
Yes, I know. It's true.
Illusions.
You do. Grass is always greener. But we're going to talk today about hair thinning, hair loss, and
hair shedding.
Hair shedding, and not just jumping on the biotin bandwagon. Now, there's nothing wrong with biotin, but it's got, really popular on social media and online, and people hear that buzzword all the time. And it can be helpful for some, but today we want to talk a little bit about other causes that you may have missed and other treatments and things that might be helpful.
Yeah, I feel like this is a great topic, and I'm super glad we're doing it because I feel like it's really common when I have patients come in and there's chronic stressors. Hair shedding, hair loss is a really common thing that shows up on the list. And I feel like biotin is always in the stash. And I promise you, if you don't correct the underlying issue of like what's going on, you can take all the biotin in the world and it's not gonna change it. Biotin helps us regrow good hair, which is good, but we have to stop the hair shedding and the hair loss. And so, as Dr. Patty was saying, there are different reasons for hair loss and hair shedding. So we want to, as always, try to figure out the underlying cause.
And I would say, sorry to interrupt, but if your reason is one cause, which Dr. Angela's about to go into, biotin may not help you.
Yeah, absolutely.
So it's really about addressing your individual cause.
Absolutely. And, as with so many things, like you can be multifactorial. You could have more than one reason why your hair is shedding and falling out. But we really want to do the investigative work to make sure that the supplements we're buying, to make sure that the lifestyle things we're doing are actually addressing the problem. So with hair loss and hair shedding, one of the biggest things that I feel like is often overlooked is low ferritin. So ferritin is a fancy word for stored iron that you see on a blood test. So a lot of time when we go to the doctor's office, we'll just get a CBC tested. So that's looking at your blood cell count, but it's not looking to see what your actual iron levels are and what your stored iron levels are.
And you have to be so low in iron for it to show up as anemia in your complete blood count or your CBC.
Absolutely. And you can start shedding hair far before then, or just not regrowing hair really well because you don't have great reserves. So that's a really important thing to look for in the hair conversation. And really, until we have reserves of like 50 to 60 on blood of ferritin, I think that's when you really start seeing great hair regrowth because your body's like, oh, we've got reserves, no problem.
Sometimes I like to even see up to as high as 70. So ferritin is one that we want to check.
And then thyroid is a huge one. And so these are, if we're seeing generalized hair shedding. And so again, in our conventional culture, a lot of times we do kind of minimal testing. A lot of times I see just TSH run, for people. And TSH is one of the tests that's important in telling us what thyroid function looks like. That's actually the pituitary talking. But it's also really important to see free T4 and especially free T3 levels. So really making sure that we have adequate, robust free T3 in order to not be shedding hair.
And for those of you who might be a little confused, TSH is the signal from the brain to your thyroid.
Yes.
So the pituitary is in the brain, talks to the thyroid makes T4, which is inactive, and then T4 gets converted into T3, which is your active thyroid hormone. So the signal from the brain may actually look normal, even if you're not making enough thyroid hormone. Now, ideally, it all is connected.
Absolutely.
So it makes sense why a lot of primary care physicians and your GP would only check TSH, the signal from the brain.
It's like a screening test, right? Oh, checks out, looks good, moving on.
Yeah, but a lot of times this will look normal and then this will not be. So it's important to at least do those three numbers.
Yeah, or if you're borderline, something like that. And also, if everything is checking out great on blood tests and they're screening blood tests, but we're having a problem, like we're losing hair, we've got to look a little bit deeper. And so another test to kind of mention on the thyroid spectrum is one called reverse T3. that elevates when we're stressed. So stress is another really common cause of hair shedding. So if the adrenals are whacked out, the adrenals and thyroid go hand in hand in the body. So we really want to do some testing to figure out, sometimes, people think they're not stressed. They're just used to really functioning. They're high functioning. They function through a lot of stress, but all of a sudden they're losing all this hair. So what's going on? So we can cross compare, blood and urine tests or saliva tests to get values for sex hormones, for stress hormones as well. And so speaking of the sex hormones, the ones we've been talking about typically are for more generalized hair shedding, but we can also have hair shedding that's like, or losing hair in specific spots. Like there's something called alopecia where people will just lose a tuft of hair from one spot or several.
You might have sort of like a little circular patch of no hair.
Exactly. And so that might be due to an autoimmune issue. It could be due to a stress issue. And so certainly, standard treatment for that is to topically inject the area with anti-inflammatory steroids to bring down the inflammation. But we want to always try to figure out what the underlying reason is that we're having, that inflammation. Or if all of a sudden we're losing hair here or here, that speaks to sex hormone changes and sex hormone imbalance. So we want to really work up the appropriate thing, because you can, again, take one specific supplement all you want that's marketed as a great hair product, but if there's an underlying problem with your sex hormones, your stress hormones, your minerals, other than biotin, the biotin alone is not going to fix it.
We can't emphasize enough, we sort of touched on it just now, but really looking at your adrenal health. Both Dr. Angela and I have seen adrenal fatigue, adrenal dysfunction be a huge factor in hair loss. And a lot of that comes, or hair thinning or hair shedding, and a lot of that comes from, I hate to say it, but basically it comes down to stress. We live in a world where we normalize stress.
And we work all the time.
And it just sits in our bodies, and there's nowhere for it to go. And so sometimes it expresses itself in terms of either other hormonal issues or just straight up hair issues.
Yeah.
So really testing your adrenals, and if you check our previous videos a while back, we did do a video on the Dutch test, which is our favorite way to test adrenals. And if you do the Dutch Complete, you can test your sex hormones, estrogen, testosterone, progesterone, as well as your cortisol and DHEA. So that would be a great way to see where your whole hormone spectrum is and how you're doing.
Very cheaply. It's a really affordable test for the amount of information.
It's not like $20 when she says it's cheap, but it's not like $1,000.
Well, and that's what, a lot of labs will cost you. So it's all relative. But
Just, let's keep it real here, okay?
So true. Okay. So, sometimes there's also other reasons why we're having stressors on the body. So you could be physically stressed, but, Dr. Patty and I were having a conversation earlier, and she was telling me about how some cases where, people with chronic viral things, that's been a stressor on their bodies. And,
So if patients have had positive Epstein-Barr in the past, or they're having active Epstein-Barr now, or patients with chronic fatigue syndrome, fibromyalgia, sometimes there's a viral component that we don't that's not diagnosed or they're not aware of. And sometimes it's not even diagnosable. If, blood work comes up that you don't have any viruses going on, but all the symptoms look like a viral issue. So this is, there is no 100% way of diagnosing sometimes, but from my clinical perspective, I have seen chronic viral issues boosting the immune system, and as Dr. Angela was saying, that chronic viruses also act as a stressor on the body. It's not just your boss at work, but it's these viruses in our body really stressing out the immune system. So it's a little chicken or the egg, It affects the adrenals get weaker, the viruses get, there's a little bit more of a home for them, so it becomes this circular issue. So really addressing the stress, addressing your adrenals, addressing the immune system if there's maybe a viral piece.
And also, a bacterial piece, even things that are not obvious, but, we were talking about the alopecia. So alopecia tends to be an autoimmune thing. So looking at what's going on with gut dysbiosis. And so sometimes there are different types of bacteria that are overgrowing that are causing stress on the body. So the bottom line is we all have very individual bodies. We need to work with somebody who can help us investigate and figure out the underlying cause of the problem before we just start throwing the kitchen sink of hair supplements at each other, because we could be spending really good money and having great intention, but just kind of on the wrong road sometimes. We got to figure out what's going on.
So once you figure out what's going on, what are some things that we can do to actually help the hair regrow?
Yes.
Obviously, work on the underlying cause. So if it's an adrenal issue, working on adrenal herbs, supplements. If it's a thyroid issue, taking thyroid herbs, supplements, possibly thyroid hormone, bioidentical thyroid hormone, ideally. So dealing, with your gut, if it's an autoimmune issue, dealing with your stress. And as we said earlier, it may not be just one thing. It never really is, to be totally honest. It's never just one thing.
We want it to be easy, but it's not how it goes.
Life is not easy, people. But, it sometimes is. So treating all those individual causes, working with your functional medicine doctor, integrative doctor, naturopathic doctor to create a treatment plan for you. But if you're having some of the symptoms that we've described and, pointing yourself in that direction is going to be helpful. So as far as what are some things we can do to help the regrowth?
Yeah. So we want to like chia pits, super quickly. So this is a place where collagen is super helpful. Some people are really into putting collagen into their shakes or their coffee or whatever. For someone who is vegetarian or vegan and doesn't want to use collagen, we can also use collagen precursors. So if we give our body certain raw materials, it will make more collagen. And so we can use vitamin C, we can use copper and zinc, and the aminos, lysine and proline in particular, but you could take like a vegan, amino acid protein powder and get that full spectrum. Minerals in general, super helpful. So we can take a mineral complex. You can
eat more greens. Getting minerals through your food is probably one of the best ways and the cheapest ways. Getting in a whole food form. You can make herbal infusions or herbal teas with things like dandelion, nettles, alfalfa, and really making a lovely ritual for yourself that way and drinking more of that.
Yeah, you can do greens juices, from an Eastern medicine perspective, frowned upon because they're cold typically, but you could add ginger or turmeric, doing things to warm them up, but that's going to really concentrate.
Yeah, and speaking of Chinese medicine or Eastern medicine, there's an herb that has actually gotten quite popular on social media, and I'm not about just like, oh, take this herb and take that herb, but there's an herb called Shou, and we'll list it down below, and it's recently gotten quite popular on Instagram and social media. But I remember when I was in school, I had a Chinese herbal formulas teacher, and he came into our class so excited because he wanted to show us all his new black
sprouty hairs,
baby hairs.
And
he was just doing it for fun. Like, it's not like he was balding or anything, but he just wanted to see if it was going to work for him, and it really was. And so I've known about this herb specifically for hair, and interestingly enough, it's a kidney tonic. And I myself sort of correlate kidney in Chinese medicine with adrenals in Western medicine, and kind of improving that source qi, that jing qi, your reserves,
the light bulbs are going off over here.
Yeah, so I can see why that herb is used for hair growth, and why it would help because of supporting your kidneys and supporting your adrenals, just like we just talked about. So that's another herb that can be helpful.
So we hope this was helpful for you. Give some of these things a try. Go check in with your natural integrative docs and get some testing done if you feel like, there's some things that might be off. I mean, you can certainly start with collagen and minerals and see if they help you, but then, definitely if that's not sorting it out, you want to figure out the underlying cause.
And check the description box below, because we just threw a lot of information at you. So we'll kind of organize a little bit for you in terms of the causes and treatments and different types of testing. And let us know if you have any questions or comments or your experience. And thanks again for stopping by. And we will see you back here soon.
Yeah, every week we post new videos, so if you want to hear from us regularly, subscribe to our channel and feel free to share these videos with anybody you think they would be helpful for. Thanks for tuning in. We'll see you back here soon.